Yes. Good evening, everyone from Kenya. Here it is 7 in the evening. 7 in the evening. And I know some places it's midday or in the morning. So, according to where you are, good day, good evening, good night, everything. As well as you are okay, everything is fine. It's fine. Today, we are dealing with a very funny case that someone brought it yesterday. Someone brought up a case yesterday, and it was appealing. Someone asked, "What of a problem of high hemoglobin levels? What can you do when you have high hemoglobin levels?" And they say you should not have exaggerated hemoglobin levels. Yes, you remember when we talked about a lot of some of everything is dangerous. So even when it comes to a lot of hemoglobin levels, it is also dangerous. To get it. So we will study today the problems that comes up with problems of high hemoglobin levels. Problems with high hemoglobin levels. We see what happens when a person has high hemoglobin levels. This is a condition that is called polycythemia. It is a condition that is called polycythemia. Mhm. Let's see. We see it's a condition called polycythemia, and I will go here and first I'll go to say to quote the normal ranges of the normal ranges of wait a minute the normal ranges of hemoglobin. So we say in adults it should be adults who are male, adults who are male. Let me write down and show so that some people can put it for documentation. 13.5 to 17.5 grams per deciliter. That is for adults who are male. And then we have female adults. Female adults, it should be 12.0 to 15.5. 15.5 grams per deciliter. Hmm? That is the normal levels of hemoglobin in adults. Then we have children. In children, newborns, we have 16.5 to 21.5 grams per deciliter. You see, that is newborns. And then when this baby comes to 1 month old, it should be 10 to 20 grams per deciliter. 10 to 20 grams per deciliter. That is for a baby who is 1 month old. And then we have 1 year. The baby has grown. He has come up to 1 year old. The baby has come up to 1 year old. It should be 11 to 13 grams. 11 to 13 grams per deciliter. 11 to 13 grams per deciliter. And then we have 5 years. 5 years to 12. 12 years. 5 years to 12 years. It should be 11.5 to 15.5 grams per deciliter. 15.5 grams per deciliter. These are values that you should keep that because they are so important. They are very important. Then in pregnancy, a mother is pregnant and should not have less than 11 grams per deciliter in pregnancy. You see, now these are the figures. Let me put them up. Anyone seeing them correctly? Anyone seeing these figures correctly? Hmm? Okay, we go on now. We are talking about polycythemia. Polycythemia is a condition whereby a person has an excess of hemoglobin, right? Exaggerated hemoglobin, which medically is called polycythemia. Mm. Conditions that cause high blood hemoglobin levels. High hemoglobin levels happens when the body produces too many red blood cells or when plasma volume is reduced on plaster. Sorry. When plasma volume is increased. You see, now we talk about uh, primary causes of polycythemia. We talk about primary causes of polycythemia. The primary source, the source of this problem always, the source of this problem always, the bone marrow produces excess red blood cells. Yeah? They produce excess red blood cells. And just a minute, someone is making a lot of noise. Yes. Now, when the bone marrow produces a lot of excess red blood cells, what happens? What happens? Yes, we need hemoglobin. We need hemoglobin, but we don't need excess hemoglobin. It is not good to have excess. It is not good to have excess hemoglobin, and we want to know why today. It is not good to have. You see, now you have taken meals, you have taken everything, you are healthy, you feel energetic, you feel nice. But at a point, you start producing a lot of hemoglobin. And you remember the hemoglobin they come from the bone marrow. They come from the bone marrow. And your kidney, let me just go through it. Your kidney tells your body this way, hey, please, we need more red blood cells because oxygen is not being transported in the brain well. So your kidneys releases a hormone called erythropoietin, sure, and then the hormone goes to stimulate the bone marrow to produce some cells that grow up to be hemoglobin that we talked about. So when they grow and they grow and they become excess, we call that condition called polycythemia vera. The bone marrow produces excess red blood cells. Imagine, it is a myeloproliferative disorder. Problem is in the bone marrow, and there is something called JAK2. The cells in the bone marrow, they mutate and they start producing. It's like a person who has given up to twins, so they start producing multiple bone marrow. There is more chemistry of JAK1, JAK2, some chemistry there. When we will start learning about now real medicine, you will see how I'll be explaining. We are just doing the overview. Secondary cause, the other cause that can cause you to have more hemoglobin, is response to low oxygen or hormone stimulation. Your house that you live is so doesn't have oxygen. You live at a place that oxygen level are depreciated. Your body starts sensing, there is a problem. What do? We produce more red blood cells so that it can transport more oxygen to them, and you know it's a problem. If you have been living in a compacted room and your area that you live, there is problems of oxygen, low altitude. The people that live within low altitude, you see, it's a problem. If you live under low altitude, please make your house well ventilated. Chronic low oxygen. In medicine, we call it hypoxia. Hypoxia. Hypoxia is lack of enough oxygen. And remember, not just living in low oxygen levels, living with some conditions. Yes, like which condition can make you not have enough oxygen? One is lung disease. Lung diseases like pulmonary fibrosis. You see, when people get COVID, they formed some things in the lungs called fibrosis. So you don't deliver enough oxygen to your body. Now, that is a problem that can make your bone marrow to start producing more hemoglobin. And then there are some people that live with heart diseases. Hmm? Heart diseases that they cannot pump enough blood. So the bone marrow is stimulated by hormone called erythropoietin in the kidney, telling it, this hormone, please create more red blood cells. Create more red blood cells. We want to send oxygen to the brain and tissues. Because you have a problem when it comes to the organs that support you to deliver oxygen. Living at high altitude when where there is low oxygen. High altitude is a problem. Severe obesity with hypoventilation. You are big. You have a big body, but you don't have enough oxygen. You live in a tiny house, and when you close the doors, there is a problem. So please, if you are big and you know your body is big, ventilate your room so that you cannot get high amounts of this hemoglobin. We will see. Sleep apnea. Sleep apnea. Sleep apnea means when you are sleeping, some people don't breathe well. When you are sleeping, you don't breathe well. And then there is this person that loves smoking. Every time you are tarnishing your lungs with something called tar that kills your lungs. And when it happens, what happens? You start producing more hemoglobin because your body thinks when it produces more hemoglobin, the tissues will get enough oxygen. Now, that is not true, but you see, you are telling your body to produce it. Heavy smoking is not good. So we have seen examples of things that can make you get low oxygen is chronic lung diseases, heart diseases, living at high altitude where there is low oxygen, severe obesity, and you're living in a place that has no ventilation, sleep apnea, problems with sleeping and you cannot breathe well, and heavy smoking, carbon monoxide exposure, heavy smoking. And then we have another one called increased erythropoietin production. Increased erythropoietin production is something, the hormone that I talked about that tells you to produce more hemoglobin from the kidney. Maybe you have a kidney tumor, and you see when you have tumors, you will start producing more of this substance. You will start producing more of hemoglobin. It will tell your erythropoietin to go up. Kidney tumors is like cancers. So liver tumors again can cause you to have more hemoglobin because they send wrong signals to the long bones where they are supposed to produce uh, average hemoglobin levels. They are sent wrong signals to produce more. Renal artery stenosis. Now, when you hear anything like medical, that bike, when you hear anything stenosis, medical term that is called stenosis, know that this means shrinking or a vessel that is small. So stenosis, when I say renal, we are talking about the kidney. Artery. Artery is the blood vessel that takes blood from the other part of the body to the kidney. So this word is renal artery stenosis. It means the blood vessels that is taking blood to the kidney is shrinking or is small. So the kidney is not getting enough blood supply. So it removes more erythropoietin and tells your body, please create more hemoglobin. We want tissues to live well. And you see, it's a problem. These are the problems that may make you have a lot of hemoglobin. Use of EPO drugs. Those people that run to stimulate their body to get a lot of energy and to be light. Yeah. They use these stimulants. They may make you to have a lot of hemoglobin, and then you get the condition is called polycythemia. Relative polycythemia. Here, RBC's number is normal, but plasma is reduced. There is another condition here that is called relative polycythemia. The red blood cells are normal, but you don't have enough blood volume. You see, there is a difference between cells and volume. The plasma, the watery part of your blood is low. Here comes it. What brings the problem? Where you have normal red blood cells, but the water part that is supposed to carry the blood, the red blood cells around your body to the lungs, from the lungs to the tissues, is low. Severe dehydration. You don't take enough fluids, so you don't have water part in your body, which is called plasma. We have burns. Some people get burned like how many percentage? Like 20%, 30%. You get it? Eh? And then your blood volume goes down. Imagine you have enough hemoglobin, but the volume is low. The volume is low. So it's not, the heart is trying to pump blood, but it's not pumping as needed. Severe polycythemia is called Gibbs-Ox syndrome. Gibbs-Ox. These people have problems. They clot blood every time. Now, we have talked about those problems. Let's think. Problems caused by high hemoglobin. If you have high hemoglobin from normal, and I've said, let me repeat this. In adults, the normal hemoglobin levels in male should be 13.5 to 17.5 grams per deciliter. In female, it should be 12.0 to 15.5 grams per deciliter. In children, this is children, newborn, you just born today, it should be 16.5 to 21.5. 1 month, heat, pap, reduces because now the baby is not using fetal hemoglobin, is using normal. It comes down to normal, which is 10, and then to 20, between there 10 to 20, and then 1 year after 11 to 13, now you are becoming a person. 5 years to 12 years, an adult, 11.5 to 15.5. And pregnant women should have not less than 11 grams per deciliter. So as we speak about those values, you know where you are. Let's go to problems that are caused by high hemoglobin, high levels, the one that people call high. I was told I have a lot of blood. No, you are not told you have a lot of blood. You are told that you have high levels of hemoglobin. Hey, Leila, welcome, Leila. We are talking. Oh, Leila is the one who asked that question. What if you have high levels of hemoglobin? Leila, we have talked about it. If you are coming in now, you will rewatch, but flow with the mood. Now, let's talk about this. These are the problems. Increased risks of blood clot, because as your red blood cells are being generated, you know what else is being generated? Platelets. What do platelets do? They clot. They cause the clotting system. When you cut yourself, they create a mesh. So you have a risk of stroke, you have a risk of heart attack, you have a risk of deep vein thrombosis, DVT. And this means if your platelets are aggregating, like they're catching each other inside the blood, you have a risk of thrombosis. This is your leg. I'm drawing someone's leg here. So this is the vein. It is called, and then it comes down. We have something called, today lights are so bright. Yes, you see these things that is here. The deep vein thrombosis. You see here, where I've drawn. It is called the dorsalis pedis. You start having clots that are aggregating there. So that is what is called deep vein thrombosis. Pulmonary embolism. In your lungs, you just have things that are clotting and they are not passing blood, because most of your hemoglobin are being produced, and as the hemoglobin is being produced, platelets are rising, white blood cells the same. Now we go to the other one. You see, we have talked about increased risk of blood clots, but the next one we'll talk about poor blood circulation because your blood is thick. It is producing more cells. Platelets are thick. So what do? You will have headaches. No tissues like the brain, the liver, the kidney, the pancreas, they are not, even the heart itself is not getting enough oxygen because your blood is thick. So you get headaches, you get dizziness, you get blood vision. When you're not getting enough oxygen, my friend, you'll have blood vision. Ringing in your eyes, tinnitus. It is called tinnitus, ringing in your because you have fatigue. And then we go to another thing. If you are fatigued, your blood pressure goes wide up. It shoots. Why? Because your heart will want to pump faster. Your body needs oxygen. So your heart is pumping faster, so that you can get oxygen in your brain, oxygen everywhere. That is called hypertension and tachycardia. Your heart pumping faster is called tachycardia. Your blood pressure going up because of this condition is called hypertension. You see, because another thing, you have something called vascular resistance. Your blood vessels are resisting. There is so thickness, and you imagine the nitric oxide gas that is produced when you have problems in your vessels. You remember what we talked about? Yes, it's called nitric oxide. So what happens when the nitric oxide is they are released? Vascular resistance, hypertension, because your blood vessels like veins, arteries, and so cannot relax. Please, if you have a question about high hemoglobin levels, ask as we continue. Please don't just ask. We are in anemia, but now this is another anemia that is not normal. Imagine having excess of what you need and then it is giving you a problem. You have excess of it, but you are not comfortable. Yeah? The only thing you should have excess and be comfortable is money and finances. But the problem is when you have a lot of money, problems come up more and you have a problem again. Now we continue. Hypertension because of vascular resistance. Leila is laughing. Today, Leila, you are answering your question about high hemoglobin levels. Now, there is one thing that I want to say. You remember the spleen? The spleen in your body, it's somewhere here. Here. Let me wake up. Here, the spleen. When you touch here, and then you feel something that is protruding, just know you have splenomegaly. Your spleen is becoming big. So let me tell you this. The spleen stores red blood cells. So if you produce a lot of red blood cells, what will happen? It has to increase in size so that you do what? You save the cells, the red blood cells. So that is a bad condition. It's called splenomegaly. You'll be touching here and then you feel something now. Why? Hi, good morning. I have a question. I explore with Anne. Let's explore with Anne. Our sister is here. Let's explore with Anne. Hi, good morning. I have a question. I cannot use my right hand. I did an X-ray and it shows inflammation. What can I use to get it better? Anne, very good question. I cannot use my right hand. I did an X-ray and it shows inflammation. Inflammation is what? Redness, swelling, and then heat around there. So what can Anne use to reduce the inflammation? Anti-inflammatories. Anti-inflammatories are the things that you should use for them. If the X-ray showed you don't have anything that hit you or the bone is not broken, anti-inflammatories. But, and everyone who is listening, find out if you have rheumatic factor positive. Are you arthritis positive? Are your uric acid normal? You get it. Those are things that can make you start having swellings randomly. If you are okay, I will advise you to use some good anti-inflammatories like what? Prednisolone, not prednisone. Prednisone is the white tablet which goes to the liver to be metabolized first, then it becomes prednisolone. No, use the blue one. Use the blue one, the active tablet, do as 15 milligrams once a day for like 15 days. Those are 3 tablets, 555. And use the normal paracetamol for an adult, 1 gram. 1 gram is 2 tablets, 500 milligrams, 2 tablets, twice a day for like a week. My friend, you will not have that pain. The swelling will go and then your right hand will be okay. But if it is so severe, visit a medical facility, see your doctor. You will be given something called dexamethasone. Dexamethasone is anti-inflammatory steroid. What does it do? It reduces the inflammation, and then you apply a cream like diclofenac cream too if it is painful. The pain has gone. That is how we kill inflammation in your body. But I've said, find out first if you have rheumatic factor positive or your uric acid are high. We talked about uric acid. We have explored with Anne. Please follow. Anne is our sister here. So that is how you can help. I went to a specialist and recommended surgery. No. Hey. No. If the right, let me ask Anne, where is the right arm having pain? Before we continue with our topic, which were, where is the, please tell me where the arm is having pain. Now, we have the problems that caused, I'm waiting for that answer from the Anne as we continue. Where is the right arm causing pain? Now, increased risk of blood clots, poor blood circulation, hypertension, when you have many red blood cells. And I'm waiting for that. Where is it causing pain? Where does you feel pain? Hypertension, splenomegaly, we have talked about it. Bleeding problems. Paradoxically can occur during platelets dysfunction. You know, when you have so high red blood cells, sometimes even the platelets can stop working because you are having so many other cells that are being produced. You see, especially in polycythemia vera, hyperuricemia. Hey, we have just talked about uric acid that is coming in. Yes. Now, let's talk about uric acid. Can cause gout due to increased cell turnover. Because you are increasing, you are having so much red blood cells, the spleen is destroying them. Let me leave a question coming. Let me leave question coming in 5 minutes. Okay. Leave it. Now, hyperuricemia, you remember I said uric acid comes from dead cells. So more cells are being produced, the spleen is killing more cells. So you will have gout because of the uric acid. Now, let me go back to Anne, the question of Anne. Anne, we only do surgery in the wrist. Yes, we only do surgery to correct something. If the X-ray showed there is only inflammation, I would love to know what causes numbness in hand and what's the remedy. Hey, Mercy has a question. So let me finish with Anne. If there is something to correct, like a swelling, a tendon, a broken bone, I can recommend surgery. But if there is no any of those, please follow my prescription. Go to the pharmacy, buy prednisolone, which is a blue tablet, not prednisone, the white tablet. Take 15 milligrams. Those are 3 tablets. You take 15 milligrams, 3 tablets for how long? For like 3 days. Then use paracetamol 1 gram, 2 tablets for 3 days, for 3 times a day, morning, lunch hour, and evening, and take the paracetamols only for 3 days. If you take the paracetamols for 3 days and the prednisolone, and if it is painful, you use a topic cream like any diclofenac cream, talk to me after 3 days. The pain will have subsided. And then, and you will not need surgery. I don't like surgeries. Surgeries, no. No, unless it is an emergency, no. If it is required, yes. Please try that one, Anne. Then there is a question down here. What causes numbness in the hand and what is the remedy? Numbness in the hand. Numbness. Tinkling sensation. One, always think of a nerve that is compressed. A nerve that is compressed somewhere. So when you think of a nerve that is compressed, what are we thinking? We are thinking either you have, let me draw a hand. What causes numbness in the hand? Yeah, I've been asked numbness in the hand. So this is the hand of Mercy. Mercy, I'm drawing a hand. These are the muscles. Now, just give me time as I draw this because I want really you make greetings to you, Benjamin the Wise Guy, and everyone in the platform. We are well, Jamaican uncle. Today we are talking about if you have a lot of hemoglobin, red blood cells that are a lot. We have seen the danger side. So I'm answering Mercy here, Mercy. Now, you have arteriosclerosis and it is pressing. You see, I don't know if people will see this, but if you see, there is something I've drawn here. Now, when you have thrombosis means sediments that are occulting they are inside your. Please, as we talk, please ask questions, like the video and share to some people. It may help some more people. Please don't yeah, if you like what I'm speaking, what I'm saying, like, share. Now let me get to this. And when you have those thrombosis and your blood is inside the vein, let me say this is the vein. This is the vein. This is the vein. You see what I've drawn? And then there is an emboli that is clotting here. And there is a nerve that is going down through that. The nerve, the blood volume will be more. Oh, okay. Let me just paste here. Then you can. If you need some private question, you will email me. Let me do this. Prednisolone. Just a minute. Prednisolone, 15 milligrams once a day for 52. And PCM, paracetamol, I've said 1 gram. 1 gram. Paracetamol, you take 1 gram. TDS for how many days? For 3 days. 3/7. Now, and there is this message that I've posted here. Please copy it somewhere and go with it in a pharmacy. Get those medication. Talk to me. If you have a cream that you apply for pain, use it. Now, I was explaining about numbness. Now, when this was my hand. When it is pressing this nerve here, what will happen? The nerve will send signals to the end of your fingers. And when it sends the end of your fingers, what will happen? You will feel numbness. Numbness is always a sensation telling you there is a problem somewhere. The nerves are being compressed. Have you ever lied on your hand like this for so long? For so long. When you wake up, sometimes it's hard to stretch the hand like this. The hand like this. It shows you that you have a problem and you should be checked. You can go do an X-ray, do a Doppler ultrasound, do those tests to find out if there is a stretch, the problem, there is a nerve which is compressed. It, in medical terms, it is called paraesthesia, numbness. Now we continue. I think I've asked, please, if you have that sensation and it just came from nowhere, go and do a Doppler ultrasound or an X-ray, both of them, so that you know if it is nerves that are being affected or if it is something that has broken inside that you're being affected with. Yes, we have talked about you can get gout if you have high red blood cells. Why? Because the spleen is trying to destroy more of them and uric acid is coming out. That was the 6th point. Now we have another point here, the danger signs. And you need to check out when you have a lot of red blood cells, severe headache, neurological symptoms, chest pain. Yes, Mercy, please do that. I think I've answered. Thanks for replying back. Chest pain. Chest pain means your heart is struggling to pump blood because it is heavy. Shortness of breath. You cannot breathe well because more cells are being destroyed. You have a lot of hemoglobin and there is no oxygen that is coming to the brain and also to the lungs. Sudden shortness of breath. Sudden shortness of breath. You are just walking, and suddenly you feel you cannot breathe well. And you are told one day you have a lot of red blood cells. Just know it is a danger sign. You need to take caution. Sudden limb swelling. You see, limb swelling, we have just talked about paraesthesia, and Mercy has told us about tinkling. So swelling means in the blood system, the arteries and the veins, there are sedimentation of dead red blood cells and protein. So blood cannot circulate well and more fluids are coming out of the limbs. Now, normal hemoglobin levels in adults should be 13 to 17 milligrams per deciliter. Adults, female, 12 to 15. I repeat, 12 to 15. But if you get 11, and the worst comes when you get below 9. What happens? This is a bone marrow disease. We are talking about high red blood cells, and it's a bone marrow disease. How the problem comes? How you cannot just start having more. We have talked how it can come when you have some condition, but mutation occurs in the bone marrow stems. Mutation is something that is not normal. Mutation is something that is abnormal that you don't have in your bloodstream. So it starts producing more blood cells instead of the normal. If you are a medical student and you are watching me, you know what JAK2, JAK1, JAK3 mutations are. Bone marrow keeps producing red blood cells every time. Does not need, even if it doesn't need them. Red blood cells increase in numbers, hemoglobin rise. You see, resulting big up your clean self, everyone. Yes, uncle is traveling, but is reserved. Big up uncle. Now, we have said the problems like blood clots, strokes. Any question, please bring the question. Strokes, heart attack, enlargement, spleen, because the spleen itself is destroying more cells, you see. Headaches and dizziness. Yes. And please, I just wanted to reply that faster, copy that message. But if you have a private message, email me and I will definitely answer you very well, very well. Headaches and dizziness, itchiness after warm bath. Imagine after you've taken warm bath, you are feeling like itching your body every time. Chronic low oxygen. It will give you high. So when you are living in a compacted house with your children, please aerate it. Get more oxygen. You see, chronic lung diseases, we have talked about them. They can make you have problems. We have talked about lung diseases reducing oxygen entering your body. Kidney detect low oxygen. Kidney then releases a hormone called erythropoietin. Erythropoietin stimulates bone marrow to release more red blood cells. More red blood cells are produced to carry more oxygen, but it doesn't go like that. Results are these. Increased hemoglobin becomes thick blood. risk of clotting and heart strain, and the heart strains to pump. So the thick blood is a problem because the heart cannot pump more blood to the veins. And then there is something called congenital heart diseases. Heart defect means oxygen. Those people that are born with a hole in the heart. So oxygenated blood mixes with non-oxygenated. This is a topic that will come very soon. Let's not talk about it. And those people that live in high altitude, air contains less oxygen at high altitude. Body adapts to produce more red blood cells. Hemoglobin increases, improve oxygen delivery. But as hemoglobin increases to increase more, you know what happens? The blood becomes thick. Sleep apnea. Those people who have problems in that one we have talked about, and I've talked about smoking. If you are smoking in the house, I'm just advising, please, the wife guy is just advising, if you love smoking, don't feel bad, but just listen to me. Listen to this. Cigarette smoking contain carbon monoxide. Carbon monoxide can kill you. Carbon monoxide binds to oxygen strongly than carbon dioxide. Hemoglobin cannot carry oxygen properly. Body thinks oxygen is low while you are the one who is giving it the carbon monoxide. And then more red blood cells are produced. Do you know the results? Elevated hemoglobin, increase of clots and risk, vascular damage. Your blood veins are destroyed. And then the hormone, not this soil, the hormone that is produced from the kidney that is called erythropoietin, it can be produced when you have tumors in your kidneys. If you have a cancer of the kidney or a tumor, it overproduces this hormone, and the bone marrow is overstimulated, and you produce more cells. Liver tumors, people who have liver cancers, cancer of the liver, how it happens, how does this happen? Some liver tumor produce EPO-like substance, the erythropoietin-like substance, what the kidney produce. So this is a cancer, but it is producing something like the kidney, the hormone that the kidney produces. You see? So the bone marrow thinks that it is the kidney producing it, and it starts to produce more red blood cells. Kidney blood supply reduces. When you have renal artery stenosis, that one we will talk. So when you stimulate, it's overstimulated, and you see this is a cancer in the liver producing something that is like erythropoietin, the hormone. So you produce more cells. And then we talked about renal stenosis. I said renal is the kidney, artery is the blood carrier, the blood vessels that takes blood to the kidney. When you hear stenosis, know that it is something called stenosis. The vein or the artery is becoming small. So it is taking less blood to the kidney. That is what we call renal artery stenosis. Then you are an athletic or a bodybuilder or a footballer, and you want to perform so well. So you take erythropoietin drugs, stimulants. That's why these people, they go to be screened to see if they are taking this medication. It is bad. Even if you will achieve what you want, in future you will have a problem. Why? It stimulates production of more red blood cells. Your blood becomes thick. Imagine. And you know the problem that we have just talked. So if you are an athlete, a bodybuilder, don't take stimulants. Don't take those EPO drugs. They will damage you. The common causes we have, like dehydration, and a person has burned the body fluids, are trying to stimulate everything to, you see, that those are normal and they are medical. But what you have brought to yourself, please let's understand. And that this brings up to a topic that is coming: medical ethics. Doctors, we are only taught to do what is not normal to normal. What do you think of a person who does BBL? A person who wants big butts, a person who do breasts to be big, a person who removes the rib to have a good shape. What do you think about it? And this is just a general question to everyone. And what do you think of the doctor who does that? No, I'm not judging anyone. I'm just asking, because medicine, according to Hippocratic oath, is bringing what is abnormal to normal and maintaining life with respect. So let's continue. Let's continue. Stress polycythemia. There are some people who have Gibson syndrome. Gibson syndrome, Gisborg syndrome. Sorry, Gisborg syndrome. Gisborg syndrome. This is a syndrome common in stress or hypertensive people who are stressed. You are always having stress. We talked about mental health. I think we will repeat the chapters that we started with about mental health. You may have Gisborg syndrome, and you start having more hemoglobin levels, which are bringing problems. And now you know why stressed people who are undergoing stress, they be sick. They be sick. Stress hormones cause plasma volume to reduce. You see, I will catch up later. It's okay, uncle. I know. Travel well wherever you are. Journey masses. RBCs count appear relatively high. You are stressed, plasma volume reduces, then the red blood cells becomes high. Now, when they become high, you see the problems. These are the problems. These are the problems. Let's learn how to live within our measures. Let's learn how to interact with people. Let's learn how to let go. Let's learn how to love ourselves. Let's learn not to compete with everyone, and our lives will be simple and cute. You see, mental health, we don't want to go to Gisborg syndrome where we have red blood cells that are high and they are giving us problems. Now you know why. If a person is stressed for so long, now he becomes or she becomes sick. Gisborg syndrome. Yes, yes, let's continue. Our time is about to be up. Yes, but if you have a question, please ask. Ask. Let's interact. Tell me what is your experience. If you have ever had an experience with more person with who was told, they always say you have more blood. No, you don't have more blood. You have more red blood cells. If it is more red white cells, that will be leukemia. So if you have someone who was told that you have more blood, interact with Benjamin, the wise guy. The wise guy listens to everyone and interacts and share ideas. Now we have at the C, Gisborg syndrome. Why hemoglobin causes problems? We are just learning poor blood flow because it is heavy, your heart cannot pump it. Blood clots, you have seen how blood clots come. Increased blood pressure because now it is thick and vascular resistant. Nitric oxide is being produced because the cells are dying. The veins are becoming. Now, I think I'll have to bring a projector. As I talk these things, I'm projecting some images so that people see them. I think that is what I'll do. Now, we go to heart attack, deep vein thrombosis, pulmonary embolism. Blood clots can cause that. Increased blood. I'm about to finish. I have 10 minutes. So I'm just going through what what high hemoglobin can produce. Layla, where you are now, listen to this. Listen to this, my sister. Increased blood thickness, poor blood flow, blood clots, and blood clots can produce stroke, heart attack, deep vein thrombosis, and pulmonary embolism. Pulmonary, think of the uh, Think of the you yes, Leila is there. She's listening. Good. Increased blood supply. Think blood increases vascular resistance. We have talked that. The spleen enlargement. The spleen enlarging because it is carrying many red blood cells and they are dying every time. So you may have splenomegaly. Increased uric acid. Why? Because the breakdown of RBCs produces purines. Purines are uric acid that brings gout. Yes, 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 yes. Anyone with a question? Anyone with a question, please? Anyone with a question, please? If anyone has a question now, this is the time to ask as we continue. I'm finishing. I'm finishing. I just want to go through this part here. Polycyth. Yes, Beatrice, ask the question. Ask, please, as I finish. Polycythemia vera is bone marrow overproduction. Eh? Main mechanism is bone marrow overproduction. Lung diseases, low oxygen. I'm waiting for that question from Beatrice. Beatrice Kaloki. Oh, hey, baby is here. Baby is here. She wants to ask me a question. Please ask. And then lung diseases, low oxygen. Heart diseases reduces oxygen delivery to the heart. Smoking, carbon monoxide reduces oxygen capacity carrying. Tumors, excess erythropoietin production. Dehydration reduces plasma volume. Very good. Very good. My dad died with cancer. Sorry about that. Sorry. My question is, can that occur in the family again? As in it is hereditary? Yes, that's a very important question. Some cancers are genetically, some cancer factors are genetically carried to the other generation. There is a topic that is coming that we will talk about cancer, and you will see how you can carry cancer from the other generation to your generation. So you can only help yourself by lifestyle, not to get them. And this one I will say, you have seen some people in their family, they always have problems with a certain type of cancer. It is because it is genetic. They carry the factor. Leila, I will explain that further. I think next week we are talking about cancer and you will understand. So if your dad had it, and we will know how to maintain next week. So just be patient. We will learn about cancer. So thanks everyone that has been in the platform. I think it has been an interactive session. Today we have dealt with a lot of hemoglobin. Tomorrow we'll just do anemia, a recap of everything. Tomorrow will be question and answering and going through what you have learned through anemia the whole day. I think I've answered questions correctly, and I wish everyone, wherever you are and wherever you, if you have a question, my email is always here, Benjamin Benja Okwesh, Benja Okwesh at yahoo.com. Please write me that email. If it is confidential, attach your number, we interact privately. And if it is open, we can decide to discuss it. If you allow us public, it's okay. Everyone have a good evening and a nice weekend. Please, those who are drinking a lot and smoking, we have seen, don't drink a lot in the weekend. Be blessed as always. Thank you so much for being in the channel. Bye. Good night, everyone.